Good morning.
Morning,
Thanks for
Kay.
joining us this morning. Thanks for coming in. Let's talk waiting list to start with, should we? They are going to perhaps double over the next 2 years until March of 2024. Your manifesto said that you were going to be there when patients needed you now. What happened?
The pandemic happened is the short answer, Kay. We knew that we had challenge with waiting lists before the pandemic. That's why our manifesto commitment was clear. But we've had 2 years of huge disruption to our NHS as it both tackled the pandemic, but also as it wasn't able to do as many routine or normal procedures as it normally would. And that figure you talked about the waiting list going up, there's just around 6 million people on the waiting list. There's around 8.5 million who we would normally expect to have come forward over the past 2 years who haven't. And therefore, we've got to make an assessment that many of them will now start coming forward. So we should expect to see, as the Secretary of State says, that list going up before we can bring it down. But we've set out the plan to do that this week.
1 in 10 people presently on an NHS waiting list right now.
It's around 1 in 9 people on the waiting list. I'm always straight with you and your viewers, Kay, about this. I think it's 1 in 5 in Wales. That's a huge figure. And every one of those people will understandably be concerned. They'll either be in pain or they'll be understandably anxious about wanting to find out. About 75% of those on the waiting list are not on the waiting list for actual treatment. They're on it for things like diagnostic tests in the large part, and they will be people who don't know what their situation is. So understandably, they'll be very anxious. That's why we're investing heavily in diagnostics, because people want to know whether they're OK or whether they do need to have treatment.
And people can move around the country to have treatment. That has been the case for some time, but people haven't been doing that, obviously, because of the pandemic. But even before that, they weren't. So how do they find out how to do that?
Well, there's a number of ways we're doing that. First one, and I think my boss, the Secretary of State, I think was on with you earlier this week. My planned care is one of those mechanisms online, people being able to see waiting times at different hospitals.
So you just log on to the NHS?
You'll be able to log on. We're developing that system as we speak.
So it's not available yet?
It's not there yet. He wanted to be open with people. That's a key part of the plan. But equally, as part of that plan, we're working with the NHS with a national coordination team who will work with clinicians who will be able to give people more information and options where they may want to stay local, but there may be a longer wait for that particular speciality in their hospital. But they may be able to go around the country. The NHS is putting in place that plan to help move people around with things like transport.
But it's not there yet?
No, it's not there. The Secretary of State set out the plan for this, and that will come on stream later this year. It's a part of that plan. We've already started, though. I know there was a lot of speculation on Monday saying, well, where is the plan? Does this mean that we're delaying helping people? No, it doesn't, because we've already announced, for example, the diagnostic centres, diagnostic hubs, which are already up and running in, I think, 60 or 70 different places. So we haven't waited, but this plan sets out that longer-term approach and, crucially, some of those targets and those trajectories for trying to bring that waiting list back down.
March 2024 is when we can see the waiting list start to fall. That's perilously close for a government, given that the election is in May of that year.
Well, I think, Kay, what's important with this plan, and you'll see it in some of the comments, I think, from some of the NHS leaders who've commented on it, is, yes, it's ambitious. It wants to bring those waiting lists down because every person on that waiting list, every statistic on that waiting list is a real person with health concerns. But we've got to be realistic about this, and we've got to be honest with people about the scale of that challenge and the impact that will have both on workload and on workforce. So what we've set is what we think is ambitious but realistic as a way to bring that waiting list down, and we want to be straight with people about that.
OK, your ultimate boss, Prime Minister's questions later on today. Is he going to apologise for what he said about Keir Starmer?
Well,
it's now time.
The Prime Minister, Kay, has been very clear. He's clarified what he was talking about. I know colleagues of mine have been on, had this conversation with you in recent days. He's clarified that he was talking about Sir Keir in the context of his leadership role at the CPS, just as, quite rightly, Sir Keir holds him to account for his leadership role over the government. That doesn't mean personal responsibility for individual decisions, but that's the context. And the Prime Minister has clarified that.
OK, well, don't take it from me.
And I'll be honest with you, I suspect that's what you will hear from the Prime Minister later.
Yeah, don't take it from me, take it from the Speaker. This is what he said yesterday.
These sorts of comments only inflame opinions and generate disregard for the House, and it is not acceptable. Our words have consequences, and we should always be mindful of that fact.
And he specifically slurred the Leader of the Opposition, didn't he?
Well, you heard Sir Lindsay there, the Speaker, about words having consequences. They do, and I think all politicians, all of us in the public eye, whether in media and politics and a whole range of individuals on things like Twitter, need to think carefully about the words we use. I have no doubt that after I come off this morning media round, I will go back to my inbox and I will receive threats and abuse. That's sadly what happens. It shouldn't happen.
Then,
I think everyone needs to reflect carefully on the language they use.
Those trolls are not the Prime Minister.
No, I think everyone
speaking from the dispatch
I think
box.
Everyone needs to reflect carefully on the language they use. Okay?
He's specifically slurred.
And well, the Prime Minister's clarified.
Didn't he, though? You acknowledge
the Prime
that.
Minister has clarified.
Let me just play for you what he said. Here we go.
This Leader of the Opposition, a former Director of Public Prosecutions, Mr Speaker, so he spent most of his time prosecuting journalists and failing to prosecute Jimmy Savile.
He was talking about him, not the position that he holds, but the
Prime Minister's been clear, and they clarified that, I think, on a few days afterwards, that he was referring to him when he said he, in the context of his role as leader of an organisation, not as an individual.
Not, from what we just heard.
That's what the Prime Minister has been clear about when he clarified by that.
And you believe the Prime Minister?
You think that?
Let's just remind our viewers exactly what he said in Blackpool when he was clarifying the situation.
I'm talking not about the Leader of the Opposition's personal record when he was DPP, and I totally understand that he had nothing to do personally with those decisions.
He was talking about the Leader of the Opposition. I just played you the
clip. He said when in the context of his leadership of the DPP and that he had nothing personally to do with those decisions. He's clear about that. It wasn't a personal point he was making, as the Prime Minister made clear. And Keir quite rightly has said when he was DPP, he took responsibility for the successes and the failures. He was totally right about that. Just as he's right to say the Prime Minister, as leader of the government, takes responsibility for all aspects of what happens in government. Someone
who was by the Prime Minister's side for 12 years resigned as a direct result of what the Prime Minister did and did not apologise. Talking about Munira Mirza, of course, she wrote in her letter, there was no fair or reasonable basis for the assertion. This was not the normal cut and thrust of politics. It was an inappropriate and partisan reference to a horrendous case of child sex abuse. She decided to resign over it.
Well, I've worked with Munira in the past when she was at City Hall in her previous role, and I have great respect for Munira. I'm very sorry to see her go. I think she's a lady of great integrity and great ability. I'm sorry to see her go. But as I say, I saw the Prime Minister's clarification there. He was clear that he was referring to Sir Keir in the context of leader of an organisation, not personally. I accept that clarification, but I would come back to the point I made to you, which is, of course, we do all need to be mindful of the language we use, as I always seek to be when I come on your show, when I speak at the Dispatch.
Which we appreciate, of course, but Julian Smith, Tobias Elwood, Robert Largan, Sadiq Khan, who's on later on, Nicola Sturgeon, David Lammy, Ed Davey, the husband of Jo Cox, who was murdered, all saying that words have consequences. The Prime Minister, why is it so hard for him to apologise?
Well, I think you're right to say words have consequences, and I think that's why it was right the Prime Minister clarified what he meant and was very clear in that clarification. I think it was clear that he was not suggesting any personal involvement by Keir. I think it's important that he made that clarification. I'm pleased that he did make that clarification, but I think he was right to make it.
So why is, such a difficult word for this Prime Minister?
Well, I think this Prime Minister has set out his position very clearly. He's clarified it. He's explained what he meant with those remarks. He explained very clearly it wasn't a personal reference. And I think that that is an appropriate way for him to have moved things forward.
Let's talk very briefly about this reshuffle. Yeah. Were you disappointed you weren't bumped up?
Kay,
Sajid Javid's job?
Kay, I've been Minister of State for Health. I think I'm the longest-serving Minister of State for Health in 20 years, I think, now.
Time for a bump up.
And I suspect if I was in another role, I wouldn't get the opportunity so frequently to come on your programme and do the morning round. Now, it's a huge privilege for me to be Minister of State for Health, particularly during a pandemic. I've had the opportunity, in very difficult times, and you and I have spoken on many occasions, but to work with some amazing people. I, like everyone else, serve wherever I'm asked to and do my best for my country in that context. And it's been a huge privilege and continues to be a huge privilege to work with the NHS and drive forward our plans for the recovery of waiting lists and support our NHS.